renal failure. What it means? Due to some reasons, our kidneys are unable to perform normal function. That is known as renal failure. There are two types of renal failures are present. One is acute renal failure and another one is chronic renal failure. What you mean by acute means it is a sudden loss of kidney functions. Suddenly, due to some reasons, kidney unable to perform the function, and that kind of failures are known as acute renal failure. We can treat on time. We can cure it if you go for treatment in a particular time. Next one is chronic renal failure, and it is a in this condition kidney get failed by taking a long period of time, and gradually kidney loses their function. That is known as chronic renal failure, and this kind of damages is permanent and it is very difficult to cure. And these are two types of what renal failure. What are the main causes of this renal failure means? First one, they are not taking enough fluid. They are taking inadequate fluid supply to the body. It leads to the renal failure. And nephric damage, nephrons get damaged, and it is also caused due to infection of various infections like streptococcus bacteria. Sometimes, and diabetes is also responsible for the renal failure, and high blood pressure. These are the main causes of renal failure. Next, symptoms. What are the main symptoms? These people, they feel frequent thirst, and they have the urge of urinate. They have desire to urinate, but their urine volume get reduced. And another symptoms, and this disease shows the symptoms of nephritis, as you know that. And these people, they having a swollen face, surrounding the eyes has also become swollen, and legs is also become swell. All these symptoms also found in this renal failure. Then what is the solution? There is only one solution for this disease, that is kidney transplantation. That means we should transplant kidney from one person to another person. While taking kidney, you must take more precautions to get rid of from the risk. It is better to take kidney from close relatives. Why we should take the kidney from close relatives means it can reduce us a risk of rejection of immune system. Because if you take a kidney from other persons who are not belonging to your relatives, our immune system reject their kidney. If you take the kidney from your relatives, some extent your genetic makeup and their genetic makeup and some chemical composition property of blood some extent same. That's why the chances of immune rejection is very less in close relatives. That's why doctors are advising to take kidney from the close relatives, from your mother, father, sister, brothers. And these days we have the medical facilities. If you have taken the kidney from other person, they will give immunosuppressive agent. It can reduces the risk of immune rejection. And this is about excretory disorders.